Go.
Good morning. My name is Linda Skalski. I am the CEO of Associated Comprehensive Care Clinic, and I would like to thank you for coming to our presentation, and I hope that you can learn about our company today and possibly invest with us. Managing the complexity of chronic illness can be costly, fragmented, and distressing for patients living with these chronic medical conditions. These patients often have unmet needs and spend much of their time trying to navigate a complex medical system. In the United States, chronic disease and conditions and the health risk behaviors that cause them account for the most costs in medical care. A comprehensive disease management clinic would meet the needs of patients living with multiple chronic diseases. Next slide, please. Okay, the objectives of this presentation are for you to understand the company, ACC, including our mission, vision, values, and future development plans. We'd also like you to understand the proposed target market, our business model and marketing strategy, and understand the funding sources for our startup business. Next slide. Our team consists of myself, the CEO, Linda Skalski, with over 20 years of mental health experience, and I am a sole proprietor of a consulting firm. Our COO, Janice Linton, has over 14 years of healthcare experience in critical care nursing, palliative medicine, program development, and leadership. Our Chief Medical Officer, Olsner Vieira, has over 10 years experience in acute care and health management and policy formation. And Misty Gaddis, our CFO, Chief Financial Officer, has over 13 years experience in chronic disease management, orthopedics, obstetrics, and emergency care. And finally, our Marketing Director, Amy Dudley, has over 7 years of experience managing a primary health care team in a military setting, and she is a proud veteran. We're happy to have them on our team. At Associated Comprehensive Care, we operate under the name ACC Clinic. We will be providing innovative health care to the community of Yulee. This clinic will deliver high-quality, coordinated, patient-centered care for adults with multiple chronic conditions. The philosophy of our clinic is interdisciplinary care, and that includes comprehensive, complex care coordination, co-management with specialists, as well as education, empowerment, and advocacy for the patients and their families. The team is going to be associated with the APRN Center in Yulee. That's where we'll have our offices, and that's approximately a 10-minute drive from Baptist Medical Center. The clinic will be a partnership equally owned and operated by advanced registered nurse practitioners Amy Dudley, Misty Gaddis, Janice Linton, Linda Skalski, and Olsner Vieira. Our partnership is equally proportionate, with each partner contributing 20% to the startup capital and taking 20% of the profit or losses. The 5 ARNP partners will function in both clinical and administrative roles. There is a combined 30 years of clinical experience ranging in areas from family practice, obstetrics, acute care, psychiatry, and palliative care. All of the ARNPs are board certified in their areas of specialty. There is a wealth of clinical and leadership experience among our owners. For additional support and regulatory compliance, we will negotiate with 2 physicians from the Baptist Medical Center. These physicians will be board certified in advanced heart failure, pulmonary disease, and palliative and hospice medicine. The clinic will target patients with multiple chronic conditions such as hypertension, heart failure, diabetes, and COPD. Our market share will include Medicare, private or commercial insurance, and Medicaid, and have approximately 20% Medicaid, 40% Medicare, and 40% private insurance. Heart disease is one of the leading causes of death in this county. Patients with heart failure have unmet needs and symptoms that a symptom burden that the clinic will effectively manage in the outpatient setting. The clinic will operate from 7 a.m. to 7 p.m. Monday through Friday with after-hours telephonic and video telehealth services in the future. The clinic will provide people with patient-centered services that will include medication management, pharmacological and psychosocial management for hypertension, diabetes, heart failure, and COPD. Medical management will follow an interdisciplinary approach with specialists and supportive services. Other services we plan to have on site will be pharmacy, psychosocial support, a chaplain, psychologist, behavioral health specialist, social worker, and psychiatric nurse practitioner. In addition to these, we will offer smoking cessation groups, diabetic educators, and nutritionists. A holistic team approach will also include acupuncture, massage, aromatherapy, and Reiki. During the preliminary stages, we will invest our time to develop a patient-focused, quality-driven strategic plan. Funding will come from combined personal savings from all of our owners for a total of $200,000 initial investment. In addition, we will be seeking small business loans from our investors totaling $300,000. The company is seeking an additional $80,000 from investors to help fund our integrated behavioral health specialist position. The team has sought legal counsel to review our contracts with physicians and partnership documents. Next slide, please. I'm going to transition now over to Amy Dudley, our marketing manager. Amy, go ahead.
Good morning, and thank you for taking the time to listen to this investment opportunity. I'm excited to invite you to learn more about Associated Comprehensive Care. Our Associated Comprehensive Care Clinic will utilize a combination of offline, online, and social media marketing techniques to capture new clients, retain current clients, and establish our presence in the marketplace in Yulee, Florida. We will use billboards, advertisements in local newspapers, and direct mail to announce our opening, location, and services provided. Why choose our service? Well, our core message says it all. Your ultimate well-being is our pursuit. Your quality of life is our mission. Multiple diseases will not mean multiple appointments. We will offer comprehensive preventive disease management and chronic disease management in a single location with collaborative holistic care. We will have an on-site pharmacy, on-site behavioral health, chaplain services, aromatherapy, Reiki to meet the needs of our population. Where your health is our pursuit affirms that our healthcare providers will make your health our #1 priority, offering the best comprehensive holistic practice in Yulee, Florida, Nassau County. We offer this unique approach to healthcare to be your one-stop clinic. Every month, we will send flyers to a target population which encompasses 5,000 households in Yulee, Florida. We will also have a daily newspaper running in the Yulee newspaper. We will also have an on-site marketing campaign which will have a sign that will advertise our clinic grand opening, our hours, and our services provided. We will also host an annual health fair that will offer blood pressure checks, blood glucose checks, information on a variety of chronic illnesses, disease prevention, weight management, and smoking cessation tips. We will use our offline marketing approach as networking. We will visit local established clinics, dental clinics, chiropractic clinics, OBGYN clinics, orthopedic clinics, and introduce ourselves and announce our services to create a robust referral network with our counterparts in the community. Our goal will be to establish a rapport with other local healthcare providers and build a network of providers that we can grow our client base with. We also intend to embrace technology. We will have a profile on LinkedIn, Facebook, Twitter, and Pinterest. We will launch a website that is patient-friendly. We will have a homepage with our overview of services. We will feature employee photographs with professional biographies, clinic contact information, hours, directions, and a description of our services provided. Our company is also cutting edge. We have established a YouTube channel that will feature a series of short educational videos that will include weight management tips, smoking cessation tips, and healthy cooking demonstrations. To again highlight our collaborative approach to healthcare, we have again partnered with local specialists. We will feature a dentist, a chiropractor, an OBGYN, an orthopedic specialist, a massage therapist, and a chaplain in these online YouTube videos. It is also our priority to come to the top of the search when people look for our services. We will be listed in the Google Places, Yahoo Local, and Bing Local. Our company is also cost effective. We have partnered with local colleges, including the Florida State College of Jacksonville, Edward Waters College, and Central Texas College to mitigate the cost of marketing. We are sponsoring an internship with these local schools to invite current marketing and business students to serve as interns within our clinic to help us get our message out. Our slogan will resonate with the people of Nassau County. We are committed to outcomes. We hold our team accountable to quality measures. We will market our business through newspaper ads, billboards, word of mouth, mass mailings, and a robust online marketing campaign. We will use our website and social media as major platforms to reach our target audience. Our clinic will continue to promote health and wellness as a variety of ways to capitalize on this broad market. We are developing business, and each partner is an essential member of our marketing and sales team, as well as a valued healthcare partner. All company personnel are members of the sales team and will be attending a company-funded workshop on business, ethics, and marketing. We do need your help and your support to make this clinic a reality in Nassau County in Yulee, Florida, and I invite you to learn more about Associated Comprehensive Care. Thank you. I now introduce you to Janice Linton.
Good morning. I'm Janice Linton. I'm the COO for Associated Comprehensive Care. The people of Nassau County value quality of life, family time, recreation, time spent outdoors, enjoying living. This video will capture the essence of who Nassau County is. The residents of Yulee and the entire Nassau County, again, enjoy quality of life as was depicted in the video. ACC's goal is to support and optimize their health so they too can enjoy their ultimate goal, Those with multiple chronic conditions such as heart failure, diabetes, hypertension can spend their time commuting 35 to 50 miles to doctor's appointments or to the hospitals because these services are on the east end of the island. Partnership for a Healthier Nassau, a collaborative health improvement process, is committed to improve the health of people with chronic diseases and reduce the prevalence of risk factors associated with chronic diseases. ACC's philosophy of care aligns with the county's healthcare goals and will target patients primarily with pre-existing chronic conditions. The clinic will serve patients in the Yulee, Amelia Island, Kent, Nassauville, O'Neill, just to name a few of the surrounding areas. We will provide a one-stop collaborative approach to their healthcare needs. We will tap into the market of Nassau and especially Yulee County to provide true population health management for its residents. We're a startup holistic comprehensive care clinic offering extended evening and weekend appointments and telehealth consults. We anticipate a soft start of 750 patients per month with a 2% growth rate per month. We are the only clinic in this area offering holistic, collaborative, comprehensive care with telehealth. Our competitors will be Baptist Medical Center Nassau, the main hospital, and their outpatient CHF clinic. CareSpot, Solantic, Amelia Urgent Care will also provide some competition because patients or parents who take their children to urgent care centers may choose to utilize the urgent centers for their primary health. Our goal is to tap into that market and provide these parents with one-stop collaborative co-management, thus optimizing their time and quality to spend with their families. Baptist Medical Center may provide competition because patients are familiar with it and trust that health system. BMC is also a recipient of the 100 Best Hospital Award for Patient Experience. The physicians from the hospital are highly trained in 24 different specialties and they practice in the Nassau County area. Associated Comprehensive Care's competitive edge will be their co-management, co-specialist approach for patients with their multiple chronic illnesses. The proposed on-site pharmacy, the on-site psychiatric nurse practitioner who will address the psychosocial needs that tend to come with patients who have chronic conditions, who struggle to cope with their life-altering conditions as their illnesses exacerbate. There'll be on-site social worker to address unmet needs of patients who utilize the hospital as a respite care. We'll offer on-site alternative medicine, such as Reiki therapy, for those who embrace a holistic care to life. We'll now turn over to Misty.
Good morning. My name is Misty Gaddis, and I serve as the Chief Financial Officer for Associated Comprehensive Care. I will discuss future development. ACC plans to grow consistently over the next 3 to 5 years, becoming known as one of the premier medical centers in Yulee, Florida. In the first year, ACC plans to sustain operations by utilizing initial investor capital provided by each partner. The team does not anticipate any losses during this first year. The first year, ACC and its providers intend to work full-time schedules with all 5 providers working at least 32 hours per week, with 3 to 5 providers on duty together. Office hours will be 8 a.m. to 8 p.m. Monday through Wednesday and 8 a.m. to 5 p.m. Thursday through Friday. We intend to offer a flexible work schedule to develop and reward employee dedication and provide a work-life balance. This first year will be spent evaluating the practice for needed scheduling and staffing changes. For example, each provider will be timed so that the team can truly determine the best way to keep our office operating efficiently. Our goal is to keep the exam rooms full and rotating during peak hours by using one room per provider and averaging 15 minutes per patient with an additional 10 minutes for vitals history with documentation. A provider can see on average 19 patients a day. Our goal is to supply each provider with 2 rooms when possible, which is also supported by the flexible work schedule. ACC is expected to pay each provider $80,000 per year. In the second year, providers will earn the same salary with the potential to earn a bonus based on profits made in the first year. In the following 3 to 5 years, each provider will earn the initial salary plus a 2% yearly increase. So there will be sufficient income to pay back the initial investment to each individual partner by year 5. Within 10 years, the company plans to have expanded into Jacksonville and bordering counties of Georgia with offices in additional 5 locations. ACC plans to be generating profits to all investors. To reach the long-term goals of becoming one of the premier medical centers in the Yulee area, ACC will focus its priorities on business expansion while continuing to provide quality health care. The first priority is to double the initial amount of patients within the second year and triple this patient volume by the third year. The second priority is to increase our Yulee office in square footage and size after 5 years. This would indicate that we have achieved our first quinquennial growth spurt. First, we will add managerial and conference offices. Secondly, we will add more patient care rooms. The expanded site will become our company headquarters, so to speak, serving as our training site for all new and incoming staff, as well as the site for any additional projects, business meetings, and annual health fair. By year 10, ACC is expected to be the principal provider of comprehensive primary care, delivering high-quality, coordinated, patient-centered care for adults with multiple chronic conditions in Yulee, Florida. ACC will become one of the largest supporters of Nassau County Health Improvement Advisory Council initiative, and that's to add to healthcare providers to the area expanded healthcare services. We will have one of the largest market share of patients in this area. To go further, we're going to evaluate the risk assessment. And there are several risks involved with the new startup business. One of the major risks that Associated Comprehensive Care faces is the competitive risk. Because insurance reimbursements will not be a negotiation factor, our major risk will come from our competitors, who are more established or owned by larger corporations with more financial leverage. With this interdisciplinary philosophy of care that includes complex care coordination, co-management with specialists, as well as education, empowerment, and advocacy for patients and their families, ACC will compete based reputation, experience, and marketability. ACC will remain on the cutting edge of evidence-based medicine and provide the most current, effective, comprehensive care. Our marketing strategies need to remain robust while targeting a specific niche of underserved patients that will become our foundation for business expansion. We also have developed an exit plan. By establishing our practice as a top medical office, ACC may become a target for acquisition or merger with another local healthcare chain and/or hospital that's in the area. The providers of ACC have established an agreement for such proposals, which includes projected acquisition terms and costs. ACC has also developed a clause in each provider's contract that will allow for potential buyouts for any current partner wanting a release from their contract. This will include a provision that prevents the exiting provider from obtaining a current patient list. If a buyout scenario arises, the partners will have sufficient cash and will quickly negotiate a buyout price, which will be contingent on the success of our offices over the prior years, with the exception, of course, of year one. So let's do a breakdown of our numbers. Overall, our goal is to take what is needed to survive initially. And our estimates is as follow. Each provider will receive an initial salary of $80,000 per year with bonus potential. With staffing costs, overhead, facility fees, and a 2% salary increase for NPs, the practice would have to bring in at least $1.2 million per year to break even. On the low end, any practice should expect to generate $97,000 to $120,000 per month in revenue. Average salary requirements drive a need for $85,000 to $87,000 in revenue per month, whereas high-end salaries demand $90,000 to $92,000 in revenue each month. These figures are representative of our practice and all 5 of our nurse practitioners. Now I will turn it over to our Chief Medical Officer, Osner Vieira.
Hello, I'm Olsner Vieira. I'm the Chief Medical Officer, and I will be presenting to you the financials today. Next slide, please. As you can see, we expect a total monthly operating expense of $98,000 more or less. What we plan to do is to have an initial investment from the owners of $200,000 plus a loan of $300,000. That will give us $500,000 to start, and with those expenses as planned, we should have at least a 3-month cash in hand reserve, and we plan to expand this to 6 months cash on hand by the end of fiscal year number 2. Some of the operating expenses that we anticipate are payroll, of course, the salary for the nurse practitioners, the 2 physicians consultants, the CPA, the attorney, and the office manager and staff. Also, we will need to rent equipment, malpractice insurance for the practitioners, and benefits. We plan to spend at least 30% of the payroll on employee benefits. ACC is a company that values human capital, and we plan to do an investment on this to make sure we have the best staff and the best practitioners to take care of our patients. Some of the benefits we're anticipating are paid time off, health insurance, 401k, and paid continuing education. With this, we still think we will have a $23,000 per month profit by the end of the first year. Next slide, please. As you could see on this graph, on the first month, we will probably be on the negative because we won't be generating any billing or any income. So this will be our first month cash on hand reserve where will be used, and then hopefully after month 2 we will grow at a rate of 2% together with our expected patient growth, and this will generate enough income to be around that $23,000-24,000 benefit at the end of the first year. We do not expect to accrue any losses since we have done an extensive market investigation and we have a good target population. And next slide, please. So what we have versus what we need at this time, we have a commitment from all 5 investors for $40,000 to a total of $200,000. That should cover our initial investment, our first month, and then we are seeking a $300,000 loan from investors that we plan to pay in about 72 months if all these projected income and projected growth accumulates. And so this is basically what we are looking from you at this time. Is a $300,000 loan to cover the first 3 months of reserves and expenses. Next slide, please. As one of the exit strategies that we have is a cash buyout. We anticipate that with the financials that we are presenting, and also with the income that we expect, as well as the number of patients that we plan to have in our census, we will be a very good investment for another chain of clinics, or perhaps a big hospital that want to expand. So if we feel that we need to move on and or cash in our investment, we think that it will be very easy for us to sell for cash to another investor or group of investors. We expect that we could provide whoever investing our company a 6% return on their money. So if we get a loan for $300,000, it will probably be paid off in 72 months with a 6% return in the investment. And with this, I will give you the back to the CEO to wrap up the presentation.
Thank you, Olsner. This is Linda Skalski again. And I just wanted to thank you for your time in listening to our presentation. We anticipate that we will have a soft opening by January 2016 and our official grand opening by March 1st. We hope that you have learned enough about our organization to feel comfortable in becoming part of something great. This will be a new and innovative brand of healthcare in Yulee, and we hope that you can be a part of it. Thank you.